Hello, good afternoon. Welcome back to my channel. Thanks for stopping by today. Please like and subscribe to this channel, and please share this video. I would really love the support. So today, as you can tell by the title, I'm going to be talking about the pathway of foreign trained doctors in Nigeria. As you all know, I'm a Nigerian and I studied in Poland, and I'm back now to Nigeria. So I want to talk about the steps I took in getting my license to practice medicine in Nigeria. I'm so sorry from like all over the place. This is the second time I'm recording this video. The first time I did, I was mute all the while. I'm so upset with myself, but it's all good. We move. Okay, so first of all, Happy New Year. Happy holidays. Today is the what's today? But yeah, Happy New Year. So whenever you're watching this, if you're watching it in 2021, Happy New Year. And I hope this year is good for everyone. I mean, considering all that we've been through in 2020. Okay, so back to what I was talking about. Foreign trained doctors in Nigeria. So a foreign trained doctor is anyone that did not study medicine in Nigeria. It does not matter if you studied in Cotonou, which is the country we share a border with, or Ghana, anywhere. It does not matter. West Africa, South Africa, Australia, Iceland. As far as you did not study medicine in Nigeria, you are considered a foreign trained doctor, and you have to go through this. You have to fulfill some requirements to be able to get a license to practice in Nigeria. So that brings me to MDCN. MDCN is an authority that regulates the practice of doctors in Nigeria, and they've organized these exams that foreign trained doctors take twice a year to be able to get this license. So the first one I think is done every April, and the second one is done in I think November or December, but I know it's twice a year. I can't really remember the months, but I'm sure one of them is done in April. So you have to go on the website and register. It's a long process, not a long process, but there's some things you need to get to be able to apply for this exam. So I'd suggest that you apply on time if you're planning to take, for instance, if you plan to take the exam in April, I suggest you start applying from January so that you can be able to fulfill the conditions to be able to write the exams. Now, previously, before 2 years ago, MDCN allowed teaching hospitals around the country to organize this exam. So each hospital will take their turns. It used to be 4 hospitals, and it eventually became 5 hospitals. So they'll take turns and organize classes. So it's 4 months of classes to train these doctors, and then they would release these exams that these foreign doctors have to take to pass. But something happened. There was some controversy 2 years ago, and MDCN scrapped all of that, and now there's just a central place where people write this exam. But the disadvantage of this is that there are no more organized classes by these hospitals officially. But do not be alarmed. Some good people have come together and organized classes. You obviously have to pay for this. Organized classes for foreign trained doctors. You can check online. There are some on Telegram. I do not have anyone to recommend, but I will ask the best friend of mine that did has a year ago, and I'll ask her which of these classes she registered to, and maybe I'll put a link to this class down in the description bar. But yeah, so most of these classes are organized online, but I would highly suggest that apart from these classes, that you go to a physical hospital and attach yourself for a period of 2 months at least, to just get accustomed to the way medicine is practiced in Nigeria. This will really help you to pass the exam, so that things don't look or sound strange when you hear them or when you see them on the day of the exam. So, and the beauty is that these hospitals around the country are readily able, or they're open to accepting foreign students that apply for this period of shadowing a doctor or shadowing the staff in the hospital. So most of them, actually, if not all, would definitely accept an application from any foreign trained doctor. Okay, so yeah, and there are also so many tools on the internet that you have access to prepare for this exam. There are some videos on YouTube that teaches students or doctors how to physically examine patients. I'll leave a link to these videos in the description bar below. And there are also some books that were produced and published by medical students in medical schools. They're very small and precise, straight to the point. That would really help. That really helped me during my time, and I'm sure it will help you if you're preparing for this exam. I'll leave the names of these books down in the description bar too. So get familiar with medical students in Nigeria or medical doctors that studied in Nigeria, and just ask them for materials that they think will be helpful for you. And that's the thing, you should get books that are familiar to people here. So like textbooks like tropical medicine and books like that would really help you to get acclimatized or accustomed to the way medicine is practiced. I mean, medicine is universal, but there are just some things that are peculiar to this environment that you need to get familiar with if you would like to pass this exam the first time. Okay, so after you've passed this exam, oh, I should mention that this exam is in 2 parts. So there's a written part and there's the oral part. The written part is just MCQs where you choose the best answer. And the oral part is divided into 2 parts. We have the OSCE and the physical examination part. The OSCE part is where, usually for this oral part, there are the environment or situation divided into stations. So when I did mine, I think we had 15 or 17 stations, 2 rest stations, and the other stations were where you'd come across a consultant and answer questions, or you come across patients, or you have to examine them. And these physical examinations, you have to, as I said earlier, I'm going to leave a link to these videos where if you watch them and you practice, beautiful. If they wake you up from your sleep, you should be able to do these things without even thinking about it. And during my time, I would practice on my sister or practice on the pillow, and on the day of the exam, it was just like this. It came so natural without thinking about it. And yeah, so in these stations, these physical examination stations, you can come across a pregnant woman. You'll be asked to examine the gravid uterus. You can come across a patient where you'll be asked to examine the cardiovascular system. You can come across a patient and you'll be asked to do a general examination. And then you also have to talk about, you also have to narrate whatever it is you're doing. Okay, so after passing this exam, you would be invited to Abuja for an induction ceremony where you'll be presented with your certificate, with your license. Now they're going to give you your provisional license and an annual license. This provisional license will allow you to be able to apply for internship. Internship is a 1-year medical program that is only allowed, that you can only do in hospitals that have the right to. So all federal teaching hospitals, all state teaching hospitals, I think, yeah. All federal medical centers have the right to train interns for this 1-year program, and you'd spend 3 months each in pediatrics, internal medicine, general surgery basically, and obstetrics and gynecology. After NYSC, you'll be given your full license. So with that, you can apply to NYSC. NYSC is this 1-year compulsory program for everybody, for every graduate actually, below the age of 30. So as far as you graduated below the age of 30, it does not matter when you're applying for NYSC. As far as you graduated below the age of, before you clocked 30 years old, you will be drafted into this program. I was sent to River State Military Hospital, Port Harcourt. It was a very interesting program. I do not, in a way, I do not regret it, because the confidence I have today as a doctor actually stemmed from the 1 year that I spent in Port Harcourt. My 1 year of internship was like a breeze, really. And we all have this saying that house officers are like house girls or house boys, where you're sent to take samples, to chase results, to transfuse, to take dictations of your senior colleagues, and that's it. But you really gain skills and gain confidence from when you become an NYSC a core member, because you're basically left at your wheels to do and undo whatever it is you want to do. So yeah, during this NYSC, because as I've said, you're left to your wheels to do whatever you want to do. It's a really beautiful period, and it's a very crucial period where you can prepare or you can actually carry out the plans you have concerning your career. So during that 1 year, you can save, prepare, and write any exam you want to. So maybe USMLE or PLAB, or if you'd like to do a residency in Nigeria, you can apply for primaries exams into the specialty that you'd like to specialize in. You pass these exams, and once you're done with your NYS, you apply for a residency program. Now, the salary scale for house officers in Nigeria is very different across the board. Granted, federal medical centers and federal teaching hospitals, they pay the highest. You can get as high as 190,000 per month, 180. In fact, I know some centers pay 210,000 naira per month to house officers. Some state hospitals pay 150, 160. Yeah, so that's something you should put into consideration when applying into these places for your internship. And obviously, this application process is not that straightforward. Most of the time, it's connection and who you know and who can help you out. And yeah, but the process for these two different parastatals, that's for the federal and the state centers, are quite different. To get into state centers for your internship, you have to go through HMB, the Health Management Board of that state. So you go there whenever they put out an ad, you go get an application form and apply. For federal science centers, you have to go to these physical hospitals to apply, so you don't have to go through any health management board. Yeah, that's pretty much it. I don't know if you've forgotten anything, but if you have any questions, any inquiries, any confusion, please do not fail to leave them down in the comment section, and I promise to reply. And if there are so many questions, I'll probably make a video answering these questions in this video. Thank you so much for watching. Please share this video and subscribe to my channel. Thank you and happy holidays. Bye.